For the past 3 years, we've used wastewater to help predict any upcoming surges in COVID cases. Now, the U of M and the Minnesota Department of Health are looking to expand that real-time virus load snapshot to cover other serious ailments, including RSV and influenza. John Croman checked in with the experts about how this could change the landscape in disease tracking.
Every time you wash your hands or flip this lever, you're sending data into the state's COVID wastewater surveillance system, something the U of M, Department of Health, and the Med Council have been using to track the big trends.
We knew in the fall of 21 that the levels of virus in the wastewater pretty accurately predicted the clinical events that were coming up in 7 to 10 days.
Those sewage COVID levels you see on the U's dashboard became essential because there are now gaps in the public health data about where the hotspots are.
There's high COVID-19 activity, but people aren't seeking healthcare because maybe they're not sick enough, maybe they've taken an at-home test. And so in those communities, in those settings, we don't have a clear window in maybe what's happening.
Now the U of M Medical School and the Minnesota Department of Health are looking to track more than just COVID in sewer treatment plant water and using methods more in line with the CDC's National Wastewater Surveillance Guidelines.
We're exploring other viruses like RSV and influenza. We don't know yet if they are going to be useful pathogens to look for in wastewater, but we're going to gather the data and take a look.
Does influenza get into wastewater in any predictable fashion? We have to answer that question. Then we have to know what the levels mean and that sort of thing. So it's really what we did at the beginning with SARS-CoV-2. We're now doing with RSV and influenza.
Some pretty sophisticated genetic science will go into getting a full picture of what they'll be tracking in wastewater going forward.
So we're also working with the NIH now at the Vaccine Research Center to develop a sequencing-based platform. So we actually sequence the RNA of all of the bugs that are in the wastewater, and we then know we've got a list of what's there.
People in the disease tracking field will tell you that no one tool will give you all the answers you need, but the more tools you have, the better job you can do seeing what's coming down the road disease-wise. At the University of Minnesota, John Croman, KARE 11 News.